We have a very special guest for you today. A lot of times, especially in the natural health community, conventional dentists don't get a very good rap. And in many instances, it's for very, very good reason. That they deserve it, exactly. But we have one of the good ones here today who's not only a naturopath and a dentist, but also a very lovely man, and one who takes a balanced approach that's, that works in the real world. So please welcome Dr. Daniel Vinograd.
Thank you. Thank you very much. Are we on? Thank you. Thank you. It's very nice to be with you again. The Gerson Institute, I just have so much admiration for what they do. And I'm Dr. Daniel Vinograd. This is Anastasia Dixon. She's one of my team members, a wonderful person. Also does a lot of the things that we preach. Vegetarian, does her cleanses. So I'm very fortunate we have a terrific team that I work with. I'm very blessed. So more than anything today, I would like for you guys to start trusting yourselves. I trust you. Why do I say that? I trust you. I trust you because as I see each one of you, I know there's a wealth of wisdom, intuition that we really don't use all that much, right? Today, what we do use most of the time, 90% of the time, is from the neck up, right? And we're bombarded all day long with messages, commercials, internet, and so we're working here all the time, and we forget that there is really a lot of wisdom everywhere else in our bodies. And I'm saying this because what I want to do today is to empower you to make good decisions and to try to understand a little bit more why you need to make the decisions that you make together with your health professionals. And so it used to be that, many, many years ago, decades ago, and still in some countries, where people go to the doctor, the dentist, and say, yes, whatever you say, I'll follow your advice. Unfortunately, it's not that way anymore. It can't be that way anymore because there are a lot of commercial interests that get on the way. There are a lot of lovely, lovely people there, wonderful healers. I have the opportunity of going to South America and Central America often, and I share some of the best, most lovely times with a lot of very, very wonderful people who are out there, and all they want to do is heal the world. So there are wonderful people out there, but we have to be realistic. There are a lot of commercial interest out there, a lot of financial interest out there, and so we have to fend for ourselves. You guys agree? Right. So why do we need to take responsibility for our health? Especially in dentistry, what the focus of dentistry has been over the years is functionality. So to some degree, I would say the dentists became the engineers of the health professions. Because why? Because we are always into detail, into repairing something, into making something functional. Unfortunately, someplace along the way, we forgot that we're actually doing our engineering inside human beings. And I'll be honest with you, when I first started practicing many years ago, I have to admit, I came out the same way, from dental school, focused on which were the most resistant materials, which ones were the most pliable materials, and I began practicing in a way that was very dissatisfying to me because I was actually just doing microengineering. Once I realized that there was a human being behind there, the gates of heaven opened up for me as far as my practice and the way I practice. I used to have a good friend who used to do a lot of the dental material research at UCLA. And I always asked him, why are you guys always looking about compression forces on dental amalgams? And how about the biocompatibility? And 30 years ago, that word meant nothing. It was like gibberish. Dental amalgams, formal cresol, a lot of these materials have been used in the body because there's been a disconnect. We are actually trying to get really beautiful results, really functional results. And how about the health of the person? We're really, bottom line, we are healers, right? We're health professionals, and we tend to forget that in our profession at times. Formal cresol, for example, is still today being used on children. When they do a child root canal, or a pulpotomy, as they're called, part of the nerve is taken out, and formal cresol is placed. Now, formaldehyde is a known carcinogen, so why are we doing this still today? Why are we still placing amalgams today? So hopefully, as we go through the lecture, we'll maybe get some clarity about what's going on. Mercury amalgams, what started first is in 1833, a couple of Frenchmen brought amalgam for the first time into the US. And materials that were available at that time were just not great from a physical point of view. And so by 1844, New York, which was really the hub of dentistry at that time, about half of the dentists were using dental amalgam. And everybody was like, wow, this is great stuff. You know, it works well. You can pack it in. It hardens. It's long-lasting. It's just the right thing to do. But there was another group, American Society of Dental Surgeons, and they're like the first heroes here. And they actually started understanding that how can mercury, which is so toxic, be okay to put in people's mouths? So they began a countercurrent here, and they began to not allow its members to use the amalgam. If you wanted to belong to this very prestigious organization, you could not use amalgam. Unfortunately, in 1856, it was disbanded, and from then on, amalgam has been the go-to material for dental restorations. Now, mercury is one of the most toxic elements known to humans. And there are people who say, you know, Dr. Vinograd, Daniel, what if you're wrong? What if, you know, once you get the amalgam bounded with the metals, with the silver and so forth, what if at that point it really is inactive? It really doesn't hurt anything. Well, I say, maybe you're right. There's a possibility that you're right. There's always a possibility that there's another opinion, another way of looking at things. But why would I even take the chance, right? Why would I put something that the US government, Department of Health and Human Services, has categorized as the third most poisonous material that they know of, right? I mean, why would would I want to put that in my mouth just to find out if somebody is right or somebody is wrong? I'm not doing that, and I'm not doing this for my patients either. As a matter of fact, we spend a lot of time and effort taking care of that and removing that in a safe manner, as some other holistic dentists do. Now, this is not me. This is not a bunch of quacks, right? This is not holistic people. This is the U.S. government that's saying this is so. I'll back it up for you. So back 30 years ago, I was already beginning to have some doubts. I had a personal experience where when I first got out of school, 30 some odd years ago, we were handling the amalgam. We're not even using gloves or mouthpieces. And we're taking the amalgam and squeezing it like this into the trash can, and then using it in people's mouths. So about 5 years into my practice, I started feeling really ill. And I felt, into my 30s, this is what being into your 30s feels like, is getting old, right? And I was forgetting things. I just felt awful. And I started really trying to find out what was wrong. And I found out I was incredibly mercury toxic. And so that was my journey. That was my wake-up call. And I began to look at the possibility that this was really a nasty material. And sure enough, I was able to cleanse, I was able to detox a lot, and a lot of things reversed. So, this is mostly what I got from my colleagues back there. So why doesn't your dentist show you what mercury amalgam is such a hazardous substance. All you have to do, all your dentist has to do is go back to the manufacturers. They'll tell you every possible injury that you could suffer from the use of amalgam. Yeah, well, for good reason, right? So, you know, I don't want you to think that I think dentists are doing this maliciously. I think there's just a lot of ignorance, a lot of doing things the same way we've always done them, and they work and they're okay, and not wanting to look, right? And this is what we see, Anastasia and I see in our practice all the time, every day. This is what we're seeing. Now, not only are amalgams toxic and they have mercury, but when they're fresh in the mouth, they are really releasing quite a bit of mercury and mercury gases. When they're old, they begin to expand. After a decade or two, they begin to expand. The margins actually separate from the tooth. And not only they start leaking again, but you start having underlying decay. And one of the things that we see often in our practice is they start cracking teeth because it's so hard, it starts expanding. And so we do multiple crowns every month based on patients coming in with fractures caused by amalgams. So these are fairly toxic restorations, and again, this is what we see in our office. Once we remove them, you know, a lot of the times, you know, this is what we find. And I don't know if you can see on that side the fracture line. Can you see the fracture line right between the two spaces there? Yeah, and those are very, very common. You'll see those fracture lines from amalgams. And that's usually what we find underneath. And, you know, fortunately today, there's so many different materials. Are all of the materials to restore teeth healthy? No. And I'm here to tell you the truth. There are really no perfect dental materials. But you have amalgam here, and then you have composites here, and then you have porcelains here, as far as, you know, how invasive they are to our systems. And they all have their pros and cons. And this is what I'm here to do today, to have you guys understand what it is that each material contains so that you guys can make the good decisions. So there are different amalgam removal protocols. So if you're going to remove your amalgams, you want to go to somebody that is going to remove them safely. If you had asbestos in your roof, you're not just going to start yanking it out. It's not a good thing to do. So same thing with amalgams. And there are a lot of different protocols. And this is where I want you guys to start really thinking. Because we go to the internet and we read all this stuff. And you know, we get patients all the time saying, Doc, this is what I want. I read this in the internet. And they say, whoever they is, and they say this is what you need to do. Some people say, you know, I only want you to follow the International Academy of Oral Medicine and Toxicology protocol, or the Hal Huggins protocol, or any of the above variations. And bottom line is that all these protocols are very important. You should have oxygen. You should have a rubber dam. You know, you should really protect your body from re-ingesting a lot of these amalgams. But really, we shouldn't take our eyes off the 8-ball. And what does that mean? It means that a poorly implemented protocol, even if you're following the best protocol, is not as good as a simpler protocol that is well implemented. And what is the most important thing is placing a good rubber dam. That is your physical barrier. You see your teeth on this side and everything else on the other side. So as you are working with the amalgam, you know, you're not going to be actually re-ingesting a lot of it. In our office, we tend to use something that we call liquid dam that we actually seal around the teeth to provide an extra level of protection. So these are some of the basics that you guys should really keep in mind when you go visit your dentist. First of all, that you want a rubber dam for the debris not to be ingested. You want oxygen to prevent you from breathing any of it, the gases, the powder. A lot of ventilation, high power vacuum. And you want a handpiece, maybe an electric handpiece that can be regulated and can actually cut the amalgams in small segments and then have those segments come out rather than grinding everything out. The more you grind, the more that you have an opportunity to re-ingest a lot of that. In our office, in addition, we use homeopathy to protect our patients. We have natural ventilation, which is, I think, important as well. And we can do nutritional guidance and quadrant dentistry. That means we actually lay a rubber dam in a quarter of your mouth, and then we clean everything out one quadrant at a time. So let's talk a little bit now. This starts getting interesting because people come to the office and say, okay, I'm ready to get my amalgams out. What are my choices? And people mostly replace amalgams with composites. What are composites? Anybody know what composites are? Composites are basically, to just keep it really simple, they're basically plastic and glass mixed together. This is what composites are. And is this better than mercury amalgam? A lot less toxic. Is it perfect? Not by far. So that's basically what a composite is. And you have kind of two options in your composite. You either have a pure composite, and I don't know of any composite in the market that does not contain BPAs. So if you have some challenges with your health, especially if you have some hormonal imbalances, BPAs are not exactly something that you want to be having, especially when you have large restorations and you're going to be chewing on that plastic crystal combination. And so the other possibility is a combination of a glass ionomer with a composite. Now, they've managed to get the BPAs out of that, but the glass ionomer, by just the way they are, just by its essence, has a small amount of fluoride. So these are your choices at this point. A little bit of fluoride, BPAs. So now you're beginning to understand that there are choices to be made, and you have to be made aware of exactly what's being used. Now, the other thing that can be used is ceramics. Why do dentists not just use ceramics all the time? Cost. It's basically cost. Probably a ceramic is probably 4 times more expensive than a composite. And most people have limitations. But again, you should understand that you have those choices and that a porcelain piece that has been baked is a lot more stable than a composite that has not. So when it comes to crowns, we don't have really, I mean, they have composite crowns, but they're really not traditionally used. And you can have different kinds of crowns in your mouth. A lot of people want to get away from the metal. Now, is metal really the worst thing you can have in your mouth? It's not good, but we have to make a differentiation here. Metal versus amalgam fillings. Metal usually does not contain mercury. Amalgam fillings do. So they're really a totally different category. Having said that, even though some metals are quite a bit more biocompatible than others, for example, they have pure titanium cores with a porcelain covering, which is probably one of the most biocompatible metal crowns that you can have. So from a biological point of view, not terrible. From an electromagnetic point of view, that's a different story. Some people really don't want metal in their mouths because it does disrupt a lot of the meridians. And then we have no metal crowns, which is mostly what we use in our practice. And you have bilayered crowns, which is a core of zirconia with porcelain layered on top. And then you have a pure zirconia, which is a Bruxer crown. all porcelain crowns have either zirconia oxide or aluminum oxide. When they are in that form, they're usually stable, and because they are baked, they're a lot more stable. But still, when I say there are no perfect materials, really there are no perfect materials. And again, you know, we have to find out what is the most biocompatible situation for you. I'm happy to say that nowadays, you know, when I started 30 years ago, it's just a handful of us that were advocating treating our patients as whole human beings and really being concerned about their whole health. I'm really happy to say that, you know, the quack has a following now. So oral disease and systemic disease. This is really interesting because I think one of the things that happened during the Industrial Revolution is that everything became compartmentalized. You know, the doctors became specialists, and the engineers became specialists, and all of a sudden, if you had a problem with an elbow, you had to go see an elbow specialist, and so. What happened is we started disconnecting the fact that everything in our bodies work at once, and it's all connected. So I'm here to talk to you about how a lot of the bacteria in the mouth actually move through our bloodstream and end up in our hearts, in our pancreas, many other organs of our body. So gum disease is one of the major ways in which we get in trouble. And when you see that inflammation in your gums, if you see a lot of redness and bleeding in your gums, it means that you probably have a lot of bacteria in there causing a lot of damage. This is a little bit more advanced stage. And what is happening here is that we all have little spaces between our gums and our teeth. We call them pockets, right? And when this is a small pocket, you know, maybe 1 or 2 millimeters here, you can actually go in with your toothbrush and clean it out. What happens with those pockets get to 3, 4, 5, 6 millimeters, bacteria can have a party down there. Nobody knows, right? I mean, they're having a blast, and nothing can touch them. These are all what we call bacteria, oxygen-hating bacteria. You know, you have in the mouth mostly a bacteria that loves oxygen and bacteria that hates oxygen. So usually they hide in there because they don't like the exposure to the air. So the same bacteria that actually has been found in the gum pockets has been found in diseased hearts and pancreas. This has been some good solid research. How do they get there? Very easy. The pockets actually, when you feel a little bit of inflammation, when you have bleeding in your pockets, you have access to your bloodstream. So all of the bacteria that are in there are really accessing your bloodstream all the time. So how do you take care of that? Number one, traditional hygiene, toothbrush and floss. And that's fine when you have 2, 3 millimeter pockets, right? But when your pockets are a little bit deeper, we actually recommend that our patients use a water pick and an ozone generator. So what does a water pick do? A water pick actually has a stream of water, and you can access 5, 6, 7 millimeter of pocket depth. Ozone generator actually can create O3 in your water, and it actually kills what we call anaerobic bacteria. That's the bacteria that hates the oxygen and dies on contact. And you can actually kill that bacteria on contact. So we've had in our office patients that traditionally would be sent to the periodontist to get their gums trimmed, right? Trimmed back, called periodontal surgery. And we've actually had them on maintenance on the oxygen, on the ozone and water pick for quite a long time with really, really fantastic results. Does that mean that you guys can't use it if you don't have periodontal disease? Not at all, because the ozone will kill periodontal anaerobics as well as caries generating bacteria. So this is a great thing. I've had my ozone generator probably for about 30 years, and you don't need to use mouthwashes, any of that stuff if you're going to have an ozone generator. Now, if you are going to get an ozone generator, I recommend that you use it in a well-ventilated area because it is irritating to breathe. It's perfectly safe once it's inside the water. That is a corona discharge. I would say 600 mgs per hour or better is good. You're going to get effective ozone in your water. 1,000 is better only because rather than leaving it 15 to 20 minutes to ozonate the water, you can just leave it for about 10 minutes. And make sure that it's a properly sealed box. You know, in the internet, they have some ozone generators, and they're kind of homemade things, and they actually expose you to a lot of ozone in the air. So where can we buy the water irrigator? You know, you can buy it most everywhere, and you know, they're fairly inexpensive. It's a really good investment. I've had a couple of patients that said, you know, I put mine in my closet because I turned it on and I had water going all over the place, and I was taking a bath with it. But if you're patient with it and you start using it, you know, you get the hang of it, and it becomes a really, really good instrument for you guys. That's the water pick. Now, you don't want the little travel model because it has a very, very small reservoir. You want really the home water pick that has the larger container. And don't spend too much money on it. You know, any water pick would do, as long as it has a large reservoir. Yeah. And of course, you want to really go to your dentist, make sure that he's actually probing. And, you know, ask your dentist, you know, do you see any pockets in here? And if you do, where? So you can go home and actually help yourself. You know, I could actually do the scaling for you every 3 months, every 6 months, whenever. But I can't, what I do for you can't compare with what you could do if you're doing it every day. Because this is actually cleaning the inside of your gums once every so often. You could be doing it every day. You're actually killing those bacteria every day. And so there's no dentist in the world that can actually compete with that. Another thing you might want to think about is if you have a lot of crowding, that creates a lot of problems with your gums. They're very hard to clean. And so you might think about maybe, not for aesthetics necessarily, but braces for this purpose, I think, are well worth it. And you know, both of the larger companies, Invisalign and ClearCorrect, their trays do not contain any BPAs. So. All right, here comes the elephant in the room. So I know Gerson advocates no root canals, and I absolutely respect that. I just want to give you a little bit of background as to what is happening here with the root canal, and again, give you information that allows you to make really intelligent choices. So, root canal controversy, do we just leave it? Do we retreat it with biocompatible materials, or do we extract it, right? That's usually the question that we have if we have a root canal, or if we're going to get a root canal, do we get it at all? So what is a root canal? Is basically you have a package of a nerve, a vein, and an artery inside every tooth. Some teeth have 3, 4, 5. Some teeth have just 1. And when there's inflammation and infection in this area right here, dentist has to make an access through the top, remove this material, this organic material right here, and then fill it with something to make the difference up, right? To just make the space up. Okay, so let me go back for a second. So why is the root canal so vilified in the internet? Some of it with very good reason. So one of my heroes, Weston Price, which maybe some of you know of, was a dentist, but he was one of the first dentists that was just really looking at the whole picture. He was just saying, let's look at nutrition. Let's look at the effects of what we're doing in people's bodies and so forth. So he was fantastic. He was amazing. He put together some nutritional research. By far, one of my greatest heroes of all time, because he is the father of holistic dentistry, really. And so what he did is he actually took some root canal teeth and he implanted them in rabbits, just under the skin, closed it up, and he found that the rabbits got sick. A lot of them had arthritis. The patients had arthritis. Actually, the rabbits developed arthritis. And some of them died from the infection. Right away, everybody said, you know, looking at this research, oh my God, root canals are going to kill you. They're going to give you cancer. They're going to give you an infection. They're going to give you arthritis, et cetera, et cetera. It's possible. It's very, very possible. What was about the root canal, though, that created the problems? And I think what was my opinion is that the root canals that have been done traditionally have been performed with hydrophobic materials, which is materials that actually contract in the presence of moisture. There's moisture in the body, there's moisture in the mouth, always. So when you have a material that's hydrophobic, you're going to actually have the materials contract. What happens when the materials contract inside of this space is that you start getting micro pockets. And in those micro pockets, you have bacteria, anaerobic bacteria that creates a lot of the damage. Again, being untouched, you can't really access that. And they become a focus of infection. So was that the problem? Was that why those root canals were the focus of infection? Well, as of maybe 7 or 8 years ago, there was something called BC Sealer, which was being used to repair knees, and you know, it had a lot of osteogenic properties. They would put it in the bone and actually would create bone around it. So the body actually liked it a lot. And the nice thing about this material was that it actually was hydrophilic. It liked moisture and it would expand. So you can see that if we have a material here that actually expands, there's a much better chance that this is going to be sealed without any pockets in it. Is this 100% the case? We don't know. We don't know. What we do know is that clinically we've had very good results with it, and that from a research point of view, it makes a lot of sense. Up to just a few months ago, that BC Sealer had to actually be placed with a gutta percha point. And the gutta percha, aside from the fact that it has a little cadmium, is basically a fairly inert, but it doesn't expand, it doesn't contract. So even if the presence of the BC Sealer is expanding, but because the gutta percha, even though it's just one point versus multiple points with traditional root canals, you still have the possibility of having very small air pockets in there. In Europe, they started using something called a C point. And that's a biocompatible point that is now taking the place of gutta percha, mostly in Europe. It really hadn't been brought to this country. And you know, this is something that I've been very excited about, because now you have a master cone that you can use. You no longer have to use gutta percha, that can actually expand together with the BC Sealer and create a nice, even, uniform expansion right on the canal. And if you obviously get enough expansion, which is usually about 20, 22%, that's enough to really create a nice, tight seal. And you know, they actually compared the use of gutta percha with the use of the new biocompatible materials. And it's basically talking about how the hydrophilic materials expand. Okay, so having said that, when do you do a root canal, when you don't? You know, I would say that when I get a patient in the office, if this patient has a lot of health issues, I probably would not go with a root canal. There are many different options, and you can explore those. Also, you can actually check some of the meridian charts and find out, I have a root canal on tooth number 3. How is that connected with what organs in my body? Is there a connection? If there is, and you're having challenges with that, I would definitely either remove or retreat that root canal. And if it's been retreated, definitely remove it. So again, you know, if you understand what's going on, now you can make decisions. Now you can ask the right questions to your dentist. You know, I had a patient that called me from Toronto recently and said, I went to a holistic dentist and they want to remove 9 teeth. I said, okay, send me your x-rays, I'll take a look at them. One of the molars was absolutely unsavable. So I said, why don't you have the doctor remove this molar, live with this for 3 months, and then multiply it times 8 and see what the quality of your life will be. So we have to balance things out, you know? We can't get so crazy that suddenly we decide. Now, of course, if I have cancer, if I have a very, very challenging situation, it might be worth it for me to do this and then to see how I'm gonna replace them. But we have to think ahead of time. How are we gonna replace these teeth? Are we not gonna replace them? Are we okay with not replacing them? Do we understand what it means to live without those teeth? The answers are yes, then go ahead. I just want you to think before we act in the consequences of the decisions they're going to be taking. No, so what is best? Implants, fixed bridges, removable bridges, Maryland bridges. So these are some of the, if you have decided that you want to extract the tooth, what are our options now? Implants. Implants are made of titanium. About 99.5% of the population is not allergic to titanium. There's half a percentage that is. We can actually find that out early. We can do a serum test, and we can find out if that's an issue. From a biological point of view, I've seen these implants integrate beautifully. The body loves them. It takes them in. However, there is the magnetic interference with some of the channels. And again, you know, if you're a very healthy individual, this might not be a problem for you. If you are seeing some health challenges, hey, you might want to reconsider. This may not be for you. Now, this is what implants were even, 6, 7 years ago. This is what implants were like. Very, very large, very invasive. A lot of the times, so big that they would actually not be, we could not place them because there was a nerve here or a sinus, et cetera. There has been some research showing that actually longer implants don't have the longevity of shorter implants because the fact that they do this. Zirconia implants. So because of the kind of practice that I have, a lot of people come and ask me, how about zirconia implants? Zirconia implants, from a biological point of view, okay. I think they're a little bit better than titanium, probably comparable, but a little bit better than titanium. The problem with those implants is that they are one piece, and they're very large and very invasive. Why is it a problem they're one piece? If you saw this implant right here, this is one piece, then you have a second piece coming out in the middle, and a third piece that is the crown. This one's come only in one piece, and then you can put the crown on top. Most of the time, your bone and your jaw is not oriented perfectly well so that you can put an implant and have the tooth come out perfectly straight so you can put a crown. So you have to actually grind those things, and when you grind them, you create microfractures, and microfractures are a big problem when you have something embedded in your bone. So I really, until the time where zirconia comes with a 2-piece implant, I'm not going to be placing them in most cases. We're eagerly waiting to see if they come up with a 2-piece. These are actually the ones that we place in our office when it's indicated, and they're called Biocompatible implants. They're bioceramic coated implants. And they're very, very small, which I like a lot because even from an electromagnetic point of view, they don't create the interference that these things were creating. And they have found out that the bone integration is great with them because they have a lot of surface, even though they're small. So this is an option. Again, not for everybody, but this is an option. And this is a case we just placed last week. Removable bridge. A lot of people like removable bridges because they feel that they are, you know, some of the better, least aggressive invasive materials. That is true in some cases, you know, to be able to have a, but obviously the quality of life is a consideration here. Taking in and out your teeth all the time and moving around, you know, it's not for everybody. Fixed bridges, of course, and you know, if you, for example, have a tooth that is compromised and you have two teeth on the side that have crowns already, or large amalgams, I would say that's a no-brainer. You should really place a bridge there. Remove, you know, use the other two teeth on the side of them and place crowns on them, and the middle part is actually going to be attached to them. You cement them. Great. So that's a no-brainer. When you have to think twice about it is when you have two beautiful, pristine teeth to the sides of the tooth that you're talking about. Do you really want to grind those teeth down to place the bridge on it? So again, more food for thought. And then we have Maryland bridges, which actually are a lot less invasive. Rather than having to trim the whole tooth and place a crown on it, you know, there's really, the tooth gets respected quite a bit more. It's not as aggressive in the preparation. Why doesn't everybody do this? Because they tend to come off. So you have to be ready to re-cement them every 6 months, every 8 months. You know, you have to re-cement them because usually the retention is not quite what it could be with a traditional bridge. So once again, you know, I urge you to listen to yourselves. You have 1.5 billion years of evolution and godliness in each one of you. For heaven's sake, listen to yourselves. Get good advice, obviously, but you know, you have to listen to yourselves and use your intuition in choosing your health professionals as well. And I think if you do that, you're more likely to make really good decisions. You know, the Chinese talk about the brain and the heart as being one organ, a single organ. And I think they got it right. Anyway, this will be right there if you have any questions or if there's anything I can do to help you guys out, be more than happy to. So I'll open it up for questions if you have any.
I have one that came in actually a little earlier on from the web stream, and that is, do porcelain fillings cause more sensitivity than composites?
Okay. What we found in our practice is that a lot of the times when amalgams are removed, you have microfractures. And those microfractures, as you remove them, actually relax and open up a little bit more. So teeth get very sensitive no matter what you replace them with. So what's important is the depth of the preparation. If it's very, very close to the nerve, you're going to have more sensitivity than it's not. And so often we'll place desensitizers. We have now a calcium hydroxide-based desensitizer. And we can actually put a coat of calcium to protect from the sensitivity. If none of those things are done, then you could experience sensitivity either with a porcelain or with do you find that to be the case, Anastasia? Absolutely. Yeah. Okay.
So you don't necessarily find a greater sensitivity with one versus the other?
No, and the materials that we use with the calcium base really makes a nice liner. And sorry. So the calcium base that we use is, again, from a biological standpoint, very healthy for the body. The teeth accept it very easily. And it just puts a nice coating down. And then with a lot of the cements that we're using, the strength is very good. And again, it adheres to the teeth in such a nice manner that reduces the sensitivity and yeah, so.
Yeah, but I don't think we have found much difference between the porcelain and the composites as far as sensitivity.
No, but it will don't put it to desensitize down.
Right. Yeah, so it's more a matter of the depth of the preparation.
What happens to the roots of good teeth when they're ground down for a bridge?
Actually, you don't grind the roots at all. Let me see if I can find here something that I could use to. Yeah, so this is a good example. So the roots would be down below here, and all we're seeing right here is just the crown of the tooth. So the root would be all the way down here. So nothing happens at all to the root, and what you're taking is a couple of millimeters off of the outside of the crown only. So it's just the outside of the tooth part itself, but not the root. The root stays in place. And actually, those are the two pillars that actually hold the bridge together with the middle part attached to them.
It's very interesting. Thank you for all that. I do have a question. I've got two questions. The first question, you talk about the bioceramic. Is it bioceramic? Is it done in Europe? You said that it's done in Europe. I'm French. I just wanted to know if it's done in Europe. That's the first question. And my first question, you talk about the bioceramic and the interference, the magnetic interference. The
magnetic,
yes,
like
magnetic.
with the ceramics?
With everything that you told.
Okay.
And I wanted to ask you if you have information such as links, surveys, and things like that, because when I'm testing people, I'm a kinesiologist, amongst 10 people, 8 have a problem. And you spoke about the meridians. It's absolutely true. Not most of the time, I noted that. And to go further to what you're saying, there is a dentist in France, in south of France. It may be only 3 dentists like that in France. We are 60 million. And he did a YouTube fantastic film. Once he had a patient, this woman couldn't even put her arm more than this higher. So she started from the ground, and she did that. She couldn't. Then he did with the camera a movie, and then he removed something or he changed something with the ceramics and so. And then suddenly she could do that. And it was stunning results, fibromyalgia and things like that. And I couldn't even believe that things can be.
You know, you can actually get charts very easily in the internet, and you can actually correlate the tooth with the meridian. And you'd be surprised what you find sometimes. Now, as far as the bioceramic material, you're talking about the root canal material? The BC sealer? Or are you talking about the crowns, or what? What specifically?
You said actually the bioceramic.
Bioceramic.
Better. And you talk about Maryland Bridge, so that's why I wanted to know.
Okay, so you're talking about the ceramic bridges, crowns, and so forth.
The bio one.
Well, yeah, I'm not exactly sure what we're alluding to, but if you want, if your question is what would be the most, and it depends on what you're talking about, but if you're talking about a crown, what would be the cleanest, most biocompatible material for a crown? The best material that you can have is probably just a pure zirconia. They're called Bruxer crowns, B-R-U-X-Z-I-R. Now, I have patients that are extremely chemically sensitive, and I've had one patient in particular that last year that tested very sensitive to everything except for the Bruxer. He was even sensitive to the glaze of the Bruxer. So the Bruxer crown is not going to be a very pretty, it's going to be a little chalky looking, and they put some glaze to make it look pretty. But the glaze is probably the most toxic part of the crown. So if you want to go with a just very, very pure crown, the cleanest that there is, if you have a lot of sensitivities or challenges, would be a Bruxer crown unglazed. And then you could probably buff it and give it a nice, finish just by buffing it. It's not the most aesthetic. Using it in front would probably raise some eyebrows. It's not terrible, but it's not the most aesthetic. They all have pros and minuses, but as far as the health is concerned, that would be the one. And then Did I answer your questions? Okay, all right.
Here's
Great.
a quick
Thank
one.
you for your question.
Is it safe to rinse with hydrogen peroxide after brushing?
Yes, it's safe. Hydrogen peroxide is perfectly safe, and it makes sense if you guys think about what we talked about, right? The hydrogen peroxide, right? Peroxide, you're actually adding some oxygen into the area, which is not very welcomed by some of this bacteria, this anaerobic bacteria. I would say, though, that a lot of people talk to me about hydrogen peroxide. There's really no comparison between hydrogen peroxide and ozone. Ozone is much more concentrated, much greater amount of oxygen per square inch, and a lot more able to kill a lot of the anaerobics. So I would say ozone would be much preferable, but you know, hydrogen peroxide is fine. In the long run, though, if you get an ozone generator, it'll be cheaper than buying a lot of oxygen peroxide. You know, you should shop it around in the internet, but they usually, a good machine runs between $200 and $250. No, it's just an ozone generator. You can use it for anything you want. There are actually people who use ozone to ozonate olive oil and do flushes. There are different things that you can do with it. So that's a whole other lecture, but yes, dear.
Do you recommend calcium supplementation or any other supplementation?
What kind of supplementation?
Calcium.
Supplementation. You know, calcium supplementation by itself, in as far as the teeth are concerned, is, I would say, useless.
Oh.
Yeah, I don't think your body absorbs it, and even if your body absorbs it, you know, your teeth are already calcified. Most of the recalcification of the teeth happens in the mouth with the enamel, directly through the mouth, and a little bit of the calcium that you could have could go into the saliva and help somewhat. But I don't think it's a major player. I would say eating well, juicing, you know, especially some of the high calcium containing vegetables would probably be much, much better than to have calcium in isolation, because calcium needs phosphorus, needs a few other elements to really be properly absorbed.
So no supplementation, period.
Yeah, you know what? I'm just really anti-supplement kind of guy. I think good nutrition by far outweighs a lot of the stuff that millions of dollars I spend or billions of dollars I spend to promote.
With vitamin D.
Well, vitamin D is a little different story, and we found some research showing that a great number of people in this world today are vitamin D deficient. So that would be the one supplement that I would consider, especially if you live in an area which is not sunny or you spend a lot of time indoors. You're welcome.
What do you recommend? Do the root canal or not to do the root canal?
That was Shakespeare's question. To be or not to be, or to do or not to do. So tell me what your situation.
He's talking about the fact that if you remove the nerve of the tooth, it leaves the tooth dead. And also that the cannules fill with germs and viruses and then penetrate the jawbone and can cause severe infectious bone damage.
Right. So this is what we talked about. Traditional root canals, absolutely. They create microspaces that get infected. So a traditional root canal, and 99% of the root canals in everybody's mouths are traditional root canals. Very few people use biocompatible materials for the root canals. So absolutely, root canal done in a traditional manner will probably be a focus of infection. As far as it being a dead tooth, that's not absolutely true. You do take some of the irrigation and innervation from inside the tooth, but there's still a lot of innervation and the blood supply coming from the outside of the tooth. So it's not totally true that it's dead. It does become more brittle. It does become more calcified. The big issue, I think, it was more with the infection part of it. Now, will a biocompatible root canal get rid of the infections? In my clinical experience, patients have gotten considerably better when we've actually retreated traditional root canals with biocompatible materials. I believe that I probably would use one in my mouth if I had to, depending on my circumstances. But because it's not a certainty, again, it depends on you. I have healthy patients that have an important tooth that would actually affect their lifestyle, the quality of life, taking it out, and I would have no hesitation. I know that that is not exactly in line with the Gerson Institute, and and this is beautiful that we can actually have a conversation. I strongly believe in biocompatible root canals for healthy patients under certain circumstances. Not a blanket statement, and I don't recommend it for everybody. No, not people with cancer, no. Not people who have major challenges, no.
So when he said the canyons, I don't know if I pronounce it very well. When he said
I'm sorry, I can't hear you.
Can you make it really fast?
Thank you. Well, when he said right here, you see, when he said that the nerves that comes down, right? That he said that nerve is going to be empty.
It's not empty. It gets filled. It's not empty.
No, I'm not talking about the tooth. I'm talking about the nerves underneath. What's happening with it?
No, the nerve underneath actually, you have nerves that are going to the teeth. Basically, that nerve just moves through. It doesn't need to connect there any longer. But it does, because there are nerve innervations around the tooth as well. So that's really not an issue. The bigger issue is the focal point of infection. I think that's really the main issue here. You're welcome.
Have you seen any correlation between cancer developing in a patient who has teeth removed, young cadaver, bone graft done, and cancer forming afterwards, like within 8 to 10 months?
I have not read any research. Have you? No, I have not. In our practice, we don't use any cadaver or even bovine graft. We use basically a calcium-based grafting anytime we have to graft bone. Who knows what the issues will be 10 or 20 or 30 years from now from using a cadaver bone. So I don't really want to expose my patients to that.
Specifically, I have, my sister had a bone graft done 8 to 10 months ago, and it was a young cadaver bone. And then after 8 months, she's found with cancer in the...
Yeah. It may or may not be related, but my gut feeling is that I would not use cadaver bone on myself, or my family, or my patients. I don't think it's needed. If there are really situations that require large bone grafts, I would be much more inclined to do an autogenous bone graft, from another part in your body and put it into your own, into your mouth, or to use what we use is calcium-based bone grafting material, which just creates a matrix and a holding pattern for your own body to actually lay the bone in. Sorry about your sister.
Hi, thank you. I just wanted to know your opinion with regards to oil pulling and oral hygiene.
Great. So oil pulling is an effective method of actually pulling some toxins out of your mouth, and I think it's been used for a long, long, long time.
Dr. Vinograd, could you explain in case people don't know what oil pulling is, actually?
Yeah, you basically use a base of oil. It could be, some people use walnut oil, coconut oil, different kinds of oils, and you actually hold it in your mouth and swish it for a prolonged period of time. And the oil actually helps draw the toxins.
10 minutes?
Yeah, anywhere 10 to 20. There are people who do it for 20 minutes, 10, 15, 20 minutes. I usually don't recommend it in my practice so much because 95% of all the toxins in the mouth are generated by bacteria, mostly anaerobic bacteria. So I'm mostly a proponent of the ozone rather than the oil pulling. It's faster, and it's, I think, much more effective in going to the root cause. If you have bacteria that are generating this, you can oil pull the toxins, but the bacteria are still in there. And they're recreating the scenario again, over and over again.
Hi.
Hi.
I have 2 questions.
Sure.
I'm having an amalgam removed. I have one in my mouth, and I'm getting an onlay done.
Okay.
Is that right? Is that normally a composite material or a porcelain material?
It can be both.
Oh, okay.
It can be both. If it's going to be, it's going to probably be done at the lab or at the dental office.
Yeah.
It's going to be milled.
Yes.
And so if it's going to be milled, your composite will probably not have any BPAs or any fluoride, which is a good thing. But it can be both, either or.
Okay.
And most of the time, it's porcelain.
Okay.
And that's probably going to be the more stable of the 2 materials.
Great. And also, what's your opinion about pulling wisdom teeth?
You know, wisdom teeth are most problematic when they're partially erupted. Because once they get partially erupted, you have a real bacterial trap there, which is basically what we talked about in the pockets. It creates a much larger pocket in there that becomes problematic in that sense. When they're in the bone, you know, you just watch them for the possibility of cysts in the future, but most problematic when they're halfway in. Yeah, you're welcome. Thanks for your question. Hi. Pulling teeth out in order to get braces? Can you speak into the mic a little bit?
No? There we
better.
go. I was wondering what your opinion is about pulling out healthy teeth in order to get a brace, because that's what they do in my country.
It's usually a good idea if you need it, obviously,
For the
and
space.
if you trust and you have a competent orthodontist, then they're pulling them because usually your arch, the arch of your jaw or your maxilla, is not large enough to accommodate all the teeth.
Right.
And so it's very important that you don't have crowding so that you don't eventually have gum issues.
So it won't create like a disbalanced situation.
No, usually
I'm done.
it's a beneficial situation when you can get your teeth aligned and no crowding.
Okay, thank you.
You're welcome.
Thank you.
Well, thank you so much, Dr. Vinograd. I know everybody's learned so much from you today. I know I learn something new every time you come. And I think everybody will join me in thanking you for being here today.